foundations of Islamic civilization in South Africa.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والعاقبة للمتقين والصلاة والسلام على رسوله الكريم سيدنا محمد وآله وأصحابه أجمعين برحمتك يا أرحم الراحمين. All praise due to Allah, the Lord, cherisher, nourisher, sustainer and master of the universe, the most gracious, the most beneficent, the most merciful. Ya Allah, it is only you that we worship and it is your guidance that we seek. Ya Allah, keep us on the straight path. Ya Allah, shower us with your choice of blessings. Ya Allah, shower us with your mercy. Ya Allah, guide us. Greetings, salam, salutations on our beloved Nabi Muhammad Rasulullah Sallallahu Alaihi Wasallam. It is time for Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faisal M.J. Sulaiman. Assalamu alaikum wa rahmatullahi wa barakatuh. And we welcome our listeners on Radio Al Ansar, CII Radio, Voice of the Cape, Radio 786, Sirius FM, Radio Islam and IFM Port Elizabeth, as well as all those listening to us on audio streaming and other platforms. Our topic for discussion this evening is basic dental care, and we intend discussing basic dental care in the light of advanced dentistry, which has advanced leaps and bounds with new technology. And to discuss this particular topic, we welcome and say Assalamu alaikum wa rahmatullahi wa barakatuh to Dr. Shabir Hassan, a dentist practicing in Durban. Shabir, Assalamu alaikum wa rahmatullahi wa barakatuh, and Jazakallah khair for joining me in the program this evening.
Wa alaikum salam wa rahmatullahi wa barakatuh. Jazakallah for having me. And once again, it's a pleasure to be here once again. And inshallah, we'll have a lovely discussion this evening.
Inshallah, as usual.
As usual.
Yeah. Okay. Before we start our discussion, I want to introduce Dr. Shabir Hassan. Dr. Hassan has completed his Bachelor of Dental Surgery degree at the Medical University of South Africa in 2001, and in 2003 he emigrated to the United Kingdom and worked in NHS and private dentistry in and around London. He returned to South Africa and resumed private practice in Durban in 2010. His current practice in Overport City started in 2013 and is currently amongst the most technologically advanced practices in South Africa. In 2019, Dr. Hassan completed a prestigious master's in laser dentistry at the acclaimed Aachen University in Germany, passing with distinction. Dr. Hashem has published research work in the field of laser dentistry and dental bleaching, and Dr. Hashem has more recently become involved in digital dentistry, third micro dentistry, and much, much more. Now, Dr. Hashem, let's just start with the very basics, okay? Very important, I think, is the question of hygiene, and especially, I mean, we're very fortunate as Muslims to use the miswak as well, which has its benefit. Let's just start. Maybe you can discuss some topics. I mean, some issues as far as dental hygiene is concerned, and also, the benefits of the miswak, inshallah.
So yes, everything starts with the hygiene. Any kind of dental treatment, any kind of dental work. Once you visit the dentist, they will all make sure that your hygiene is in immaculate condition. Now, we find quite commonly patients say, "But doc, I brush 2 times a day, and I'm still having problems." So that recommendation of 2 times a day is a minimum. And alhamdulillah, as Muslims, we using the miswak as one of the implements of brushing our teeth, we can, we have got much more brushings than just the regular 2 times a day. But generally, if a patient's finding that 2 times a day is not enough, the first thing they need to do is increase that brushing. And one of the simplest ways, so we want to make it simple for patients that, just telling them increase your brushing, but we've got to find solutions that are easy for them to implement into their daily life and continue. And one of the easy solutions for us Muslims is brushing when we make wudu. Now, using the miswak is an implement of brushing, and alhamdulillah, the miswak in itself has a lot of benefits, but the main action of the miswak is to brush your teeth. So if you take the miswak and you just quickly rub it on, Allah Ta'ala will reward you for trying to emulate, the sunnah of Nabi Sallallahu Alaihi Wasallam, but that was not the intention of Nabi Sallallahu Alaihi Wasallam. The intention was to actually use the miswak to clean your teeth thoroughly. So I normally advise my patients that if you can't maintain a miswak, because one of the problems of keeping the miswak is maintaining the miswak. We lose it, it becomes moldy. It's difficult to maintain. Then using a toothbrush at the time of making wudu is also you will also get benefit from that. Not the full benefit of not the full benefit of the miswak, but you will also get benefit from it.
Jazakallah khair for that, Dr. Hassan. Just to remind our listeners, this is an interactive program, and the WhatsApp number for your questions is 060-904-1056. We are talking to Dr. Shabir Hassan, and we are discussing basic dentistry. Dr. Hassan, in fact, our first question has come through as well.
Yes.
So we're going to just take the question, take it from there. It says, Assalamu alaikum wa rahmatullahi wa barakatuh. If I have trigeminal neuralgia, can I extract the other teeth, and is it fine to put false teeth?
Because the trigeminal neuralgia is the pain is emanating from the nerve itself and not from the teeth. If you're going to extract the other teeth, it's not going to take away your trigeminal neuralgia. What you need to do is consult a neurologist and work out a plan of managing the trigeminal neuralgia. There is no cure for the trigeminal neuralgia, but there is a way of managing it.
Mm-hmm. Another question that comes through is, if someone had to extract their permanent tooth, is it recommended to put a bridge since the implant is much more expensive?
Well, when you look at the costing of the implant versus the bridge, you're looking at similar costing. So I don't see that as being a valid argument for putting a bridge rather than an implant.
Mm-hmm. It's coming back now to our basic our basic hygiene, our basic hygiene, etc. Let's talk about flossing. Okay, one of the questions that comes to is, bleeding while flossing deters patients from flossing. Does this compound the problem?
So what happens is that if the gums are bleeding while you're flossing, it means that your gums are inflamed. So usually after a little over a week of regular flossing with the bleeding, you will find that the inflammation in the gum will start to go down, because you're taking away the cause of the inflammation, which is food particles accumulating around there, and then the bleeding should go away. However, if after a week, maybe 2 weeks of flossing, and you're still getting bleeding, then you need to consult your dentist, because there might be some other underlying issue.
Mm-hmm. Let's just get onto some gum diseases. Just before we get onto the heavy stuff, I can put it that way. Yeah, maybe we can discuss some gum diseases. But things like dental caries being predominant. Maybe you just deal with that.
So gum disease is called periodontitis, and periodontitis is rather silent. That means people will have periodontitis, but they wouldn't feel any pain. So they will continue with this periodontitis for 10 or 20 years. Then they'll commonly tell you, "Oh, I've never seen a dentist for 20 years. I've never had."
Mm-hmm.
But when they come in, their teeth are almost falling off, and it's too late.
No.
So, but the telltale signs of periodontitis is bleeding gums, bad breath, and you notice that there's a kind of accumulation of something around the gum line, especially the lower bottom teeth. There's some kind of accumulation. So those are all telltale signs of periodontitis.
Talking of periodontitis, does periodontitis cause fluctuating and high blood glucose levels, resulting in uncontrolled diabetes?
So it's contributory.
Mm-hmm.
So it doesn't cause the thing, but it is contributory to high glucose levels, and getting your mouth into good health will obviously help those glucose markers.
And what about cardiac problems? Does it contribute to cardiac problems as well?
So in two ways, there is a contribution to cardiac problems.
Mm-hmm.
The one way is that when they look at the contents of the arteriosclerotic plaque that blocks the cardiac arteries, it's made up of various things, and one of these things is bacteria.
Mm-hmm.
And this bacteria bears a very similar profile to the bacteria that we find that is involved in periodontitis, or in that calculus that builds up around our teeth. The second issue is that with periodontitis, there's an inflammation of the gums. This inflammatory process has an effect on on the rest of our body as well. So other chronic conditions or other conditions like cardiac disease, Alzheimer's, all have been linked to periodontal disease.
And are diabetics at a greater risk for gum diseases?
Yes. So I think about 2 or 3 times more at a higher risk of gum disease than non-diabetics.
We're discussing basic dental care in the light of advanced dentistry, and our guest this evening is Dr. Shabir Hassam, a dentist practicing in Durban. And if you have any questions for Dr. Hassam, you may forward them to us via WhatsApp on 060-904-1056. I just want to remind you that doctors and guests on Medical Files will help you with any medical problems that you pose by giving you advice on air. However, they do not have your full medical history and have not examined you, so please verify the advice given to you on air with your regular doctor or dentist who knows your medical history, your allergies, etc. Neither the doctors nor the relevant radio stations nor the Islamic Medical Association of South Africa will take any responsibility whatsoever for any adverse reaction caused by the advice given on Medical Files. Now, Dr. Hassam, I just want to go a bit more advanced now. I think more up your field, I think more up your alley. Now, there's been great advances in technology in the field of medicine, and in radiology, it has allowed more pinpoint accuracy. This is now happening in the dental field as well. Having said that, what is digital dentistry? And maybe you can just discuss some advances in digital dentistry.
Okay, so a very important point you made about, in the medical field and in terms of radiology, that nowadays we find that everything we go to hospital for, they want to diagnose something, it's off to a CT scan. They say CT scan, and whether a medical aid authorizes that, or so it's CT scan is quite a good diagnostic tool. Fortunately, we are now I think it's about 6 or 7 years that we have already had CT scan machines in dental offices. So in my office, I think we're nearly onto our second CT scan machine. But this is called, it's a different one from the hospital one. It's called a cone beam CT, but the CT gives us that images. Now, how that transfers into digital is that CT image can actually be digitized into a different type of digital file format. So we can take that CT image, digitize it, and print a model of the bone and the inner bony structures of the mouth. This helps us in different surgical processes and in diagnostics. But the CT or the dental CT or the cone beam CT has now opened up a lot of different avenues, and we're starting to see more things. We're starting to see that a lot of our previous root canals have got chronic infections in them. Patients are asymptomatic, but the chronic infections are there, eating into the bone. We're able to digitize, as I said, we're able to digitize these CT images and plan for implant placement. We can plan for surgeries, etc. So this is part of the digital dentistry. Now, the other part, which came in a few years later, was digital scanners. So a digital scanner is we're able to take a digital scan of all your teeth. So if you've ever been to the dentist and you see them take an impression, so most of that is out of the window, because with the digital scanner now we can get a digital scan of all your teeth. So with the digital scan of the teeth and the CT scan, we can actually merge these two things and create a more fuller model, a digital model to work from.
Okay. Talking about bones and implants, so one of the questions come in is that I'm 64 years old and I've been told that I need implants, but because I have receding gums, they can't do it.
So the only way to know whether you can have implants or not is firstly, this cone beam CT. The cone beam CT will be able to say if you have enough volume or depth of bone. And even if there isn't enough volume or depth of bone, there is still bone grafting, which can be done to increase the volume or depth of bone.
060-904-1056. We are discussing basic dentistry, and of course, advanced technology in dentistry as well. Now, Dr. Hassan, in surgery, more and more minimal invasive surgery is being done, resulting in minimal damage to tissues when operating. What is microdentistry, and what are the advantages? Should all dentists be using this technique?
So, over the past few years, we find that now the recommendation is that most dentists should, at minimum, be using something called dental loops. So, dental loops are on little binoculars on a glasses. You see them, doctors and dentists wearing, which gives you a kind of magnification. But the best magnification comes from a surgical microscope.
Okay.
So the microscopic dentistry improves our vision. If you've got a 5 times magnification on the microscope, that's a 25 times improvement in the vision that we are seeing. So if you see something better, you treat something better, you get better outcomes. And that's as simple as that.
Okay, another question that's come through is, how often should I get a dental checkup?
So the recommendation is every 6 months, and then your dentist will tailor it from there. So some patients, we will see them once a year, and some patients we'll see them every 3 months, but majority of patients we try to see every 6 months. And also the dental insurance normally covers for the treatment to be done, for the checkup to be done every 6 months.
Now, Dr. Hassan, where accuracy is important for a better outcome, placing valves in the heart or snipping nerves in the heart for irregular heartbeats or coils in aneurysms with guided assistance has revolutionized treatment of these conditions. Can you discuss guided implant surgery versus conventional dental implants?
So with guided implants, as I was mentioning earlier, the combination of the CT scan and the dental scan, we are able to make a full digital model of your teeth. By putting this onto specific software, we can then design where the implant will go in the patient's mouth. Once we've done that, a 3D printer will print out what we call a surgical guide. This surgical guide at the time of implant placement means that we only need to make a small keyhole in the patient's gum. Compared to the regular implant, what the surgeon has to do, he has to cut the gum and flap open the gum, exposing the bone, and then he can see where the implant's going to go when he places the implant. With guided surgery, we digitally know where the perfect position of the implant is, and we only make a small keyhole and we place the implant through the keyhole. And the benefits of this is that, I won't say all the time, but I've had quite a number of occasions where patients have said, "Doc, have you really placed the implant? Because I went home and I felt nothing."
Okay.
Or they said, "I just took a Panado." That's, most of them said we took one painkiller. That's, I would say 90% of the time. Yes, you do have the 10% where there are other issues, but 90% of them are perfectly okay.
I'm just going to go through my question that's coming through. Is that dental lasers in the treatment of tongue ties in newborns, is that the best way?
I think it's the best way, and that's my opinion, because instead of taking the newborn baby back into theater, exposing them to the risks of theater and surgery in theater, in a just short 5-minute procedure, this can be done on the dental chair. Yes, it's difficult for the parents. The baby is crying. The baby is going to cry if I have my hands in their mouth, but not because they're in pain. But the procedure is done quickly. There's no bleeding, and the baby is perfectly well after that.
Doc, I'm just fluctuating from the advanced to the basic. Coming back to basics, what are some of the best ways to practice good oral hygiene, and also, maybe a few steps to good dental health that you can recommend?
Okay, so the first thing is to get the brushing right. So everybody says, "Oh, we brush our teeth," but are you brushing your teeth effectively? Effective brushing your teeth starts from how you hold the toothbrush, how you apply the toothbrush to all surfaces of the teeth, and how long you spend brushing, and the frequency of this brushing. So a good habit is that after you eat, you should brush your teeth. Whether you use toothpaste or not is not important. You can use toothpaste in the morning and the evening, but after you eat, you should brush and get the food stuff out of, that is accumulating in the mouth. Because the types of diet that we have these days is a lot of refined types of carbohydrate. And this thing in the mouth is feeding a certain subpopulation of bacteria which are unhealthy and is causing dental disease. So the main thing is good brushing. And once a day you can floss as well. If you want to floss more than that, that's excellent. But if you are having dental problems, you first need to fix that. Once you fix your hygiene, then you can start fixing your teeth. You can't fix your teeth without fixing your hygiene. You can't have orthodontics if you are not. If the child can't have orthodontics if he's not brushing his teeth properly. If he's not brushing his teeth properly, he can have orthodontics. He's going to end up with more problems than he started with. So it all starts with the hygiene, and you have to have meticulous oral hygiene. And not only that, meticulous oral hygiene is not only to prevent dental diseases, it is a sunnah. Nabi Sallallahu Alaihi Wasallam had meticulous oral hygiene. There's so many hadith on his hygiene, the thing. But the problem has been, now I'm digressing a little bit, but the problem has been that we are focused on the stick. This miswak stick, yes, it's sunnah, it has a lot of benefits, but it is not a magic stick. It is, it's not we're missing the point of the excellent oral hygiene and focusing on the stick.
In other words, use the stick properly, correctly.
Use the stick properly, and if you don't use the stick, it's still a sunnah to clean your mouth with other implements. But if you don't do it for yourself, do it for the love of Nabi Sallallahu Alaihi Wasallam.
Absolutely. Now, how do I prevent tooth decay, gingivitis, and other problems?
Same thing, it's the same thing, just good hygiene. If you do good hygiene, you just need that good hygiene. You just got to be motivated and brush well, floss. And the thing is that people give up. They say, "Oh, I can't floss." Don't ask me to floss. But okay, if you're not going to floss, just brush well. Just do that. At least do that. Don't give up on everything and don't do nothing.
060-904-1056. We're discussing dentistry. If you have any questions, please forward them to us via WhatsApp, 060-904-1056. We've got 2 minutes before we take the ad break. Should I use mouthwash regularly?
So mouthwash, has benefits. And yes, if you are a patient with established gum disease and everything else has not worked, now you can add mouthwash onto your hygiene routine. But if you're not brushing and you're not flossing, and then you think mouthwash is going to fix your issues, unfortunately that's not going to happen at all. So I don't normally recommend mouthwash, but in certain instances, yes, we do.
And just before the ad break, at what age should I take my child first to see a dentist?
So you can take a child, from a very young age, but what happens is around the age of 4, they start to become more understanding. So, there's a difference in the child that he starts to understand logic and what we explain to him about brushing his teeth. So if he hasn't had any dental problems till then at that age, you can bring him to the dentist, and then we can start talking to him, explaining to him about the hygiene. The other thing patients miss out on, and it's not a ploy for dentists to make more money. There's enough teeth in the mouth for 10 dentists on my road. There's enough dental problems to keep all the dentists busy. But I have seen, you mentioned that I worked in the UK, and I've seen the benefit of bringing children for their checkups every 6 months. And it's not to check their teeth, but it's for them to start realizing the importance of their teeth, the hygiene instructions, and getting to realizing the importance of their teeth, so that they grow up knowing that I go to the dentist every 6 months. I check my teeth, and my teeth are important to me.
You listen to Medical Files. We'll take an ad break. We'll continue on the other side of this. To stay with us.
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio visual experience. Now available, full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickfield Road, Overport. Simplex Radio, the name you can trust.
Verily, every soul shall taste death. Prepare yourself for the inevitable. Join the Al-Atar Foundation for our annual Ladies Ghusl Workshop on Saturday, the 26th of October, from 10 a.m. to 1 p.m. Seats are limited, so don't delay. Register now by calling 031-208-1601. Save the date, 24th October, Al-Ansar Conference. Secure your spot and ensure you are prepared for life's final journey.
Are you tired of working from home? The Al-Ansar Delhi is excited to introduce its new co-working space, perfect for remote workers to meet and network. Enjoy a productive work environment, high-speed Wi-Fi, and delicious food and drinks at your fingertips. Al-Ansar Delhi co-working space, where work meets flavor.
Attention all plumbing and building contractors. Discover high-quality plumbing supplies at unbeatable prices with Plumcore. From pipes to the latest tech, we have it all. Visit Plumcore today for expert advice, exceptional service, and in-store discounts. Call 031-350-3737 or visit us at 16 Intersite Avenue, Ambeni Business Park. Plumcore, your trusted partner in plumbing supplies.
You're listening to Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faisal M.J. Suleiman. We are discussing basic dental care, and our special guest is Dr. Shabir Hassam, a dentist practicing in Overport, Durban. And if you have any questions for Dr. Hassam, you may forward them to us via WhatsApp on 060-904-1056. I repeat, 060-904-1056. Now, Dr. Hassam, everyone wants a clear, straight line of teeth with a good bite. Orthodontics has also undergone changes. Clear aligners are a hype or a solution to wide orthodontics.
Clear aligners has been something that's been around for quite a while now. I would say almost 20 years, maybe longer than that. And the first one started with something called Invisalign. So the basic concept is that from a digital scan of your teeth, and it goes back to digital dentistry, the teeth are progressively moved on the digital scan, and plastic aligners are made to push teeth into place. And with the evolvement of this technique over the last 20 years or so, it's improved so much that it's now quite a good modality of treatment, which I would say is almost as good as normal bracket orthodontics. Some claim it can be even better. But a lot of guys still like the traditional bracket orthodontics because they have a lot of control over it. And the concept with bracket orthodontics is that the dentist, when he sees you on a monthly basis, he adjusts it to the movements he thinks suitable. With clear aligners, from the beginning, the case is planned right to the end, all the way just at the start. And the aligners are made thereafter for you to use, and they adapt it along the way if they have to. So there's a more deeper thought process, etc., going into the clear aligner system as well. The one difficulty with clear aligners is cost and patient. Well, two difficulties: cost and patient compliance. So the cost nowadays is almost 2 times or 3 times the price of regular bracket orthodontics, right? And you invested this money in your 13-year-old child, and they're not wearing it. It's a big this thing. Whereas with brackets, they can complain, they can do what they like. It's fixed. They can't do anything about it.
Absolutely.
If they pull it out, we'll put it back on for them. They got no choice. So Patient compliance has been a difficult issue, especially with the young patients, but with adults, it seems a bit better.
Question comes through. Assalamu alaikum wa rahmatullahi wa barakatuh. My son is 31 and was on quite a lot of meds until this year. His teeth are all breaking or falling off. What's the best treatment?
So, if he was in quite a lot of meds, I would imagine that he had quite it affected his saliva flow. And saliva is one of the main buffers in our mouth. And without saliva, our teeth start to decay quite rapidly. So, his teeth have broken down from decay quite rapidly. He'll need, obviously, to go into a dentist and start looking at ways to restoring them. But just on that point, that there's been quite a few studies recently on the effects of a chemical called silver diamine fluoride. So in patients like this, when we see them earlier on, we can apply this chemical onto their teeth and we get a reduction of 80 to 90% in tooth decay.
Okay.
So, if we had picked it up earlier in his 20s, we would have kept this application going, and later on when things settle down, we could have started to restore the teeth.
Jazakallah khair for that, Doctor. Assalamu alaikum, Faisal and Doc. What is the best kind of front dentures to have for the front teeth without taking it out? Jazakallah khair. Without taking out the dentures, not the teeth.
Without taking it out for the front teeth, then you implant supported dentures. So implant supported dentures, you'd look at dentures which are screwed onto implants. So there's a process, we call it all on 4. So we only place 4 implants into the mouth, and then we make a denture that screws on to these 4 implants. So they're the thing. In terms of cost, they're much more cost effective than a more complex implant treatment, and they work very well. Good success rates on all on 4s.
Okay, another question comes. They are mentioning a product. I'm not going to mention it, but they're not going to mention the product, but I think you know what I'm talking about. It says a toothpaste like this particular product, which costs about 4 times more than the normal toothpaste marketed for healthy gums, effective and beneficial for the gums. And for what indication would one want to use this toothpaste and not use any ordinary regular toothpaste?
So firstly, yes. So firstly, that particular toothpaste that you're mentioning, I think is haram.
Okay.
So, the secondly is, it's one of those brands where the toothpaste companies just comes and loads, copious amounts of it to us.
Okay.
And what we dentists end up doing is giving it out to patients free of charge because it's there and they're giving it us to give. So it becomes like like we're recommending it, but it's, I wouldn't give my dog that to brush their teeth.
Is it? Okay. So, Brother Yusuf, there you get your answer there. Okay. Talk about brush. What is the best way to whiten one's teeth?
So if you want to whiten your teeth, now this whitening your teeth can mean that you want to remove the outside staining from your teeth. And that's outside staining on your teeth, like tea, coffee, smoking, etc. You use a whitening toothpaste, a smoker's toothpaste, a toothpaste which is more abrasive, which polishes off those stains. If you want to actually change the inherent or the deeper color in your teeth, the best way is called dental bleaching. And dental bleaching uses a process or a chemical called hydrogen peroxide, which penetrates into the enamel into the underlying dentine and bleaches out the yellowness in our teeth. Now, our teeth get progressively yellower as we get older because the dentine becomes yellower, the outer enamel becomes thinner, and all these factors lead to us having more yellow teeth as we get older. So if we want to look a little bit younger, and we all do it, we dye our hair, we color our beards, so why not whiten our teeth as well?
I like that. Okay, I've never heard of a purple toothpaste. Have you heard of a purple toothpaste? Because another question comes, Salams, what about purple toothpaste?
Yeah, you get you get lovely toothpaste now on the market. You get black ones, you get purple ones. I use a red strawberry one. Oh, it's amazing. It tastes I want to eat it, and then brush my teeth with it.
I mean, okay. Your thought on the purple one?
The purple one, I haven't seen the purple one, but yeah, I mean, it's just a colorant in the toothpaste. There's nothing else to it. The toothpaste itself, its benefit in toothbrushing may be about 4 or 5%. 95% is your toothbrush. So, it doesn't matter. People ask what's the best toothpaste. It doesn't make a difference. Use anything. And the other thing about toothpaste, and just another bit of advice, is when you brush your teeth, don't start brushing with the toothpaste. Brush so that the brush works and brushes out all that biofilm or plaque. And then when you're finishing off, you put a little bit of toothpaste, and then you just use the toothpaste.
So toothpaste is more like a mouthwash?
No,
not at all.
No,
okay.
no.
Okay, now I just thought because I've always dentists say you don't need to use a lot of toothpaste. So I think most would just give a bit of taste in the mouth kind of thing.
Yeah, it's got fluoride in it, which
Okay.
is shown to have, which is shown to have some benefit. But there's also some controversy with fluoride as well. So,
Okay.
but at the moment, people are still recommending using fluoride. But if you go into the biological dentists, and that they would say absolutely no fluoride, no sodium lauryl sulfate, and that in the toothpaste.
Now we've been talking of digital dentistry,
Right.
but what is digital dentistry and how is it changing the face of dentistry?
So digital dentistry, as I mentioned before, with the dental scanners, we're able to digitize the teeth in your mouth. So we're able to take a digital image of the tooth in your mouth, put it onto a computer, and then manipulate that. If we want to make a crown, I don't need to take an impression anymore. I just take a digital scan.
Okay.
I don't have to. The lab doesn't have to come pick it up. I just send it out. I just email it to them. My lab technician can be in America. He can design, or my lab designer can be in America. It can be anywhere in the world. He'll design it. Another milling center will make the crown and send it to me in a few days. So, we globalized it. We made it the thing. So that's one aspect of digital dentistry. The other aspect of digital dentistry is, what we say about the radiographs. Now, because of digital dentistry and these X-rays, we can now add the next layer, which will be AI on top of that. Okay. So so one thing is leading to another thing is leading to another thing. So we're advancing. Digital dentistry is the first step, and then all these other things will start coming in around us.
I'm going to talk to you about AI after the ad break, but there's two very short questions I'm going to put to you before the ad break. The first one is, we're still on the question of toothpaste. Is charcoal toothpaste any better? I think you mentioned black toothpaste, and I think that's where charcoal toothpaste comes in.
No, that's just a colorant in the toothpaste. The charcoal toothpaste doesn't really have any benefit. Once again, toothpaste companies use these as different marketing thing. There's no harm in it. In the old, in I wouldn't say the old days, but in certain the things that I've heard people say that we used to use charcoal to brush our teeth, and it was just an abrasive. To give you this thing, but in terms of benefit, no, not really, no scientific benefit of charcoal.
And the question comes is miswak toothpaste good?
Miswak toothpaste, alhamdulillah, I've read some things which have shown that some of the products in the miswak toothpaste are quite excellent. So alhamdulillah, I would think that's quite a nice toothpaste to use.
Alhamdulillah. Okay, we've got like a minute, but I'm going to take the ad break 1 minute early, because the minute I ask you a question, we'll go into the ad break. So let's take a break. We'll continue on the other side of this, inshallah.
Shimmer, sparkle, captivate. Nothing less than a masterpiece. Droplets of gold inspires precious design. Platinum bursts with intricate freshness. And every pure diamond becomes more than just a girl's best friend. Voda Gold Gem Jewelers, where timeless dreams become a reality. We tailor-make designer gold, platinum, and diamond jewelry. Trade in or remodel your old gold. Clad yourself with classy name-branded watches. We offer insurance valuation and free zakat calculation. Visit us at 534 Ridge Road, Overport, or call 03 031 208 9142. Voda Gold Gem Jewelers, manufacturers of fine gold and diamond jewelry.
Join Huda SA as we raise funds to complete phase 2 of the finishes of the Ilovo Masjid construction. We humbly request your generous Sadaqah Ejariya and Lillah donations. Your contribution helps build a masjid and earn everlasting rewards. For more information, contact Huda SA on 031 271 3049 or visit www.huda-int.org. Act now and earn your share of sawab. Donate today. Huda SA, building communities, strengthening faith.
Famine, conflict, and severe economic decline make the humanitarian crisis in Yemen the worst in the world. More than 20 million Yemenis do not know where their next meal is coming from, and over 10 million are suffering extreme levels of hunger. With your support, the Al Imdad Foundation delivers essential food aid to starving Yemeni communities. It's a question of survival. So let's do what's right. Donate online at alimdad.com or call 0861 786 243 for more information.
Are you or a loved one battling the disease of addiction? Is your family, life, relationships, work suffering due to alcoholism and substance abuse? Zensai Treatment, Recovery and Wellness Center are addiction specialists offering specialized psychotherapy and naltrexone therapy to help overcome addiction. Zensai offers hotel-style facilities to allow your loved ones to regain their dignity and overcome alcoholism and drug abuse in the most comfortable setting possible. Fight addiction. Call Zensai Treatment, Recovery and Wellness Center, the addiction recovery specialist on 031 563 0751.
You listen to Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faisal M.J. Suleiman. We are discussing basic dental care, and our special guest is Dr. Shabir Hassam, a dentist practicing in Durban. And Dr. Hassam, you did mention artificial intelligence just before the ad break. Now, what is artificial intelligence, and more important, what's the effect of artificial intelligence on advanced dentistry?
So, we're just at the beginning of artificial intelligence coming into healthcare and into dentistry. But already we're seeing it in some of our dental programs that the artificial intelligence is helping us do some diagnostic work and some, when we're looking for certain nerve canals on the x-rays, etc. The artificial intelligence in the program is helping us to do that. So it's making our life easier, it's making our work easier. But what's coming next is, and especially in digital x-rays, is the artificial intelligence able to giving you a pre-diagnosis. So, and how that is helpful is that it helps the dentist if he misses anything or anything like that, but it also increases patient confidence that my dentist hasn't missed anything out because they seem to trust the artificial intelligence more than the dentist.
Yes. And lots of people have faith in it.
Yeah. So in terms of that, once they see that, it helps us in the thing, and obviously it helps us in different types of diagnosis, making our work easier.
So previously we had Professor Google, we had Dr. Google, we had Mufti Google. Now it's going to be Professor AI here.
Professor,
Okay. There's a question from a listener that comes in and says, how do these advances that we're referring to in made in dentistry impact on patients and on dental practices in general?
So, the impact on patients is improved dental care. If we look at, a common procedure like a dental crown, which was usually we used to take an analog impression, etc. Now, sometimes the difficulty in the situation made that it was difficult to make an accurate crown in that circumstances, and human error along the way made there were problems. Now we consistently get excellent fitting crowns onto patients using digital dentistry. So the consistency of giving excellent treatment, I would say, is much better. But we have not. It has not impacted on costs. So the cost of doing a guided surgery implant versus the cost of doing a regular implant is still the same, because the cost of actually doing that guided surgery using digital has brought the price down, because it's easier, it's quicker, it's more cost effective.
Okay, questions come through via WhatsApp. says that, in fact, I think, I don't know if this is for a dentist or a dietitian, but how does diet impact oral health, that's sugar, acid, etc.? And there's a second question also that comes in from the same listener. Can you discuss the benefits of a balanced diet for oral health?
Yes. So, like with everything else, a balanced diet is important for our general health. And the same for oral health. If we're eating too much, which we all do, have too many refined carbohydrates, we are at a greater risk of tooth decay. We are at greater risk of gum disease. In our development, our bones are forming weaker, our muscles are not as strong, etc. So it's simple. It has an effect on the whole system.
Mhm. And does hydration affect oral health?
Hydration affects oral health, dehydration, dry mouth, and as I said, one of the important factors is our saliva. Our saliva is the controlling fluid in our mouth. Without saliva, you can't eat. You're very prone to tooth decay. Your mouth becomes more acidic. One of the main complaints of people with of bad breath, and the cause is dry mouth.
Mhm, mhm. Yeah, importance. Okay, I think we've discussed that. How can our listeners recognize early warning signs of oral health problems?
So the early warning signs is, for gum disease, it's the number one is bleeding gums.
Mhm, mhm.
Bleeding gums is the number one thing. In tooth decay, if you start getting a lot of food caught between the teeth, that's usually a sign that you're getting food stuck in there, and if you're not flossing it out regularly, those are going to give you tooth decay, etc.
Now, many of us make lots of mistakes when it comes to our daily oral hygiene. Can you maybe identify some common mistakes that we make?
So the first one is holding the toothbrush wrong.
Okay.
So we all tend to hold the toothbrush with a fist grip,
Mhm.
and the right way to hold the toothbrush, and it's the sunnat way as well, is with a finger grip.
Okay.
Now, the reason for that is with a fist grip, you're going to apply too much of pressure. You're going to do a scrubbing type of motion, which wears the gums away and starts to give you sensitivity and what we call toothbrush abrasion. And this is a very common problem. We see it every day in dental practice. And the way to avoid it is just keep on reminding yourself, hold the toothbrush with your fingertips, like a pen, or if you know how the sunnat grip of the miswak is, that's similar. So
Mhm.
once again, we're seeing the wisdom of Nabi Sallallahu Alaihi Wasallam. We are only realizing this now and advising people to do that. So that's the one. The other one is too much toothpaste. You're putting too much toothpaste. So what happens is you're forming a foam in your mouth before you actually brushing your teeth properly. And then because of the minty feeling of the toothpaste, you feel nice and fresh, but you actually haven't cleaned your teeth properly. So the best is not to use the toothpaste, and only at the end put a little bit of toothpaste.
Thank you for that question. I think we've dealt with this, but I'll just pose a question. Maybe you can just repeat the answer for the benefit of the listener. Salams, what is the relationship between poor dental health and heart problems?
So poor dental health and heart problems, it's, as I said before, it's the bacteria and it's the inflammation, both contributing to cardiac disease.
Mhm, mhm, mhm. Yep. Sorry, man. You did talk about dental, what you call now, regular dental checkups. That was one of the questions that came through as well. And you also spoke about the children that should go. Now, are there any additional tips and advice that you can share with us insofar as dental hygiene is concerned? Or oral hygiene, rather, yeah.
So as I mentioned before, that the important thing is more regular brushing, and one of the easiest ways is to keep a toothbrush or a miswak where you make wudu. And also when the children are growing up, when they're learning to make wudu, we grew up, we were told about the miswak, but it wasn't insisted and taught to us as a necessity of wudu. I know it's not a necessity of wudu, but it should be almost a necessity of wudu, that our children are grown up with. You always use a miswak or a toothbrush to clean your teeth at the time of wudu, and we also need to do that, and we need to inculcate that in us, that we always need to the thing. And if you don't want to, for those going to the mosque and don't want to carry the toothbrush to the mosque, then it's a better excuse to make your wudu at home and then proceed to the mosque, and this is more sawab as well.
Another question's come through. This listener is Muff for another question. You're most welcome. The minute I put toothpaste in my mouth, I gag. What should I do? Because I tend then not to brush.
So don't put the toothpaste. You can brush without the toothpaste. As I mentioned before, that the value of the toothpaste is only minimal. So brush without the toothpaste. That's fine.
Double barrel question comes in. Are there any benefits of using an electric toothbrush? And the second question is, how often should we replace our toothbrushes?
So the electric toothbrush has some benefits. One of the main benefits is its ability to polish the surfaces of the teeth. So the electric toothbrush gives you a better polish on the surface of your tooth, and the better polished surface takes longer for the plaque biofilm to reform on that polished surface. So so not only does it clean, but it gives you a much, because of its rotating, oscillating action, it gives you a better polish. So I like the rotating, oscillating type. There's also a ultrasonic type, which is good at cleaning and massaging the gums.
Another question is, are there any myths or misconceptions about oral hygiene that you'd like to dispel?
Toothpicks won't break your won't damage your gums. They're okay to use.
So they won't break your fillings as well.
They won't break your filling. If you
Okay.
if you flossed and a filling came out, it was meant to come out. It just instead of it hanging there and rotting underneath it, you just made it come out sooner. So
Okay. All right. Look, as we said, dentistry or dental technology has advanced substantially. What does the future look like?
So every time I think we're there, we still tend to go more forward.
Okay.
But digital dentistry, and as we said with 3D microscopy, and then now I see that some companies are coming out with, you're able to overlay the X-rays onto what you're viewing, so you can so it's just the advances in digital dentistry are gonna are there on the cusp. Robotic dentistry, a lot of people want to know. I think that's
that was going through my mind right now. Yeah.
Robotic dentistry, I think even though I've seen a dental robot cut a crown on a tooth, I think that actual technology might be still quite far away from actual practice.
Dr. Shabir Hassan, I want to thank you for joining me in the program this evening. There is one more question that's coming through, but whilst that listener is typing on the question, I'm sure you have a message for our listeners.
The message is that whatever it is, digital dentistry, advanced dentistry, etc., it all starts with good hygiene. There's no point in you spending a lot of money on your dentistry if you can't do good hygiene. And the simplest way to do good hygiene is more effective brushing. You just need to brush more effectively. It's not products, it's not mouthwashes, it's not toothpaste. It's what you and your toothbrush can do. So brush well, brush regularly, and you just got to think about it a little bit. If I've eaten something for breakfast and I'm going to brush my teeth at 9 o'clock at night or 10 o'clock at night, there's 12 hours something is hanging around in my mouth and I'm adding more stuff to it. Come on, you got to be real. You got to clean it much sooner than that.
Two questions have come in and we've got 30 seconds to answer. What is the danger of X-rays on the mouth? That's the first one. And the second question, Salams, I have to use Fixodent every day. Is there any other option that's available? And is this halal? Jazakallah. Okay, let's deal with both in 30 seconds. Sorry, Doc.
Okay, so what was the first?
Okay, effect of X-rays on the mouth.
Okay, so digital X-rays have very low dose radiation.
Sorry, the danger of X-rays on the mouth. Yeah.
Okay, so it's a radiation that's problematic, but on digital X-rays compared to old film type, the dose is very low. You're getting much less radiation than walking through an airport. Fixodent, I haven't heard any reports of it being haram. Unfortunately, there isn't any much good alternative to that. The best alternative is try to get better fitting dentures or pay for implants.
Dr. Shabir Hassan, Jazakallah khair for joining me on the program this evening, and thank you to all the engineers in the various radio stations for having engineered this evening. Time for me to round up. I want to thank you to all the listeners for having joined us on the program and for all the questions that were sent in as well. Inshallah ta'ala, Medical Files will be back on air next week, Tuesday. So till then, for myself, Faisal MJ Sulaiman, it's Assalamu alaikum wa rahmatullahi wa barakatuh.
The people of Palestine need your support now. Africa Muslims Agency is on the ground, already providing food, medication, and emergency supplies in Gaza. Donate any amount to Heal Palestine at Africa Muslims Agency